What does the real India look like in this pandemic?
So the real India looks like real rural America. There's fear, high rates of unvaccinated individuals, patients coming to the hospital confused, scared. And there's a real fear after what India lived through during the second surge that it's all about to start again. And they're getting ready and getting prepared to be able to fight the new variant.
So you get a cup of coffee with the leadership at Pfizer, at Moderna. You and Dr. Adalj will sit down with them and say, look, here's the reality of helping the rich and poor of the unvaccinated. What is the plan to get the unvaccinated vaccinated?
Twofold. Globally, the issue still is supply chain. And so improving supply chain, providing vaccines with adequate shelf life, ensuring that those vaccines reach that last mile, that last village is really key. And that involves partnerships with government. Locally and in other higher resource settings, the issues are really around anti-vaccine sentiment and how do we combat anti-vaccine sentiment. And I don't think any of us thought that we would be having this conversation 20 months into the pandemic.
Dr. Hansoti, you said that India is getting prepared for the Omicron variant to spread, akin to what we saw in the second wave, which was terrifying by all accounts, by the images that we saw, and I'm sure by the aftermath that you witnessed. What does that look like with the Omicron variant based on the initial evidence that we have?
So luckily for us, what we're seeing from South Africa is while reinfection is common, hospitalization is common, less patients are requiring oxygen. Now, what we saw in the second surge in India was that a lot of patients died from critical hypoxia and lack of oxygen access. Oxygen access in India has been significantly strengthened, but there are other policies in place. They're improving border control, improving same-day rapid testing prior to travel. And all of these innovations will help, the spread of the virus in going to those rural, underserved areas.
One confusion that a lot of people have, myself included, is how much less virulent the Omicron variant is. We don't have concrete data showing that. But the real issue here is, when does this move from a virus that we need to counter and social distance for and mask and vaccinate repeatedly versus a common cold, versus something that you're going to get every once in a while. It's not going to be fun, but you get over it. You live, you move on.
So we really try to think about, what does it mean for a virus to be endemic? So scientifically, an endemic virus is one that has predictable variations, seasonal variations like the common cold, that its impact on the health system is manageable and bearable and acceptable to society. And the third is that the number of people infecting another person is one. And we're not there with COVID. We know that these surges can have catastrophic consequences on the health system. We're already seeing in the United States several hospitals claim they have no more ED beds, no more ICU beds, and our resources are outstripped. So I think what my concern is, by calling this endemic, that there'll be a complacency that'll set in, which I think is unnecessary because there's still deaths that need to be avoided in our future.
Based on the trajectory of the pandemic, when will we get to that point, Dr. Hansoti?
I think as soon. We are now expanding vaccines. Vaccine uptake has improved in the United States in the recent weeks. We are really expecting the youngest in our society, the under fives, to have access to vaccines very soon. And as the virus continues to evolve, we do think while transmissibility will increase, the virulence is unlikely to continue to increase. So I'm really saying, next Christmas, we will not be having this conversation. I will not be on the show, I hope.
Oh, no.
I heard that 12 months ago, Tom. Yeah.